Craig Melvin, I bring you greetings from NBC News and the Today Show. Adam Moore, there he is, Adam. Adam, a part of the Westport 10, whose son is even cooler than he is, which is saying a lot. I saved Adam for the end because I thoroughly enjoy him. Not that I don't enjoy everyone on the panel, but I've known Adam perhaps a little longer than most, and he's the CEO and co-founder at Wheelhouse, and I'm not going to do it justice, but I know that it is technically described as a wellness and personal development group. For folks who aren't familiar with it, what is it? How did you get into it? And what do you guys do now?
Wheelhouse is a venture that my wife and I started 5 years ago. My wife is our executive medical director. We are diverse in the greatest sense. We have a black owner and a woman owner. We opened Wheelhouse because we recognized that there was a trend that was happening in medicine. And that was that people are having an adversarial relationship with their health. They go to the doctor because they have to. They take care of their health because they need to. Very few people do it because they want to. And we wanted to create a place where people wanted to come and didn't want to leave. A place that people fell in love with their health again. Instead of just focusing on the symptoms, we wanted to focus on the relationship people had with their health, knowing that if they improved their relationship, the healing process would take care of itself. And that's exactly it. That's exactly what happened. We are entirely team-based. We're going against all the status quo. We try to figure out how do we keep the dollars as affordable for everyone while having the highest experience. As soon as you come in, first thing you would notice is our waiting room looks like a living room. We have plant walls, birch trees, lo-fi beats playing on all the speakers, art from all over the world. It's designed to hit you on every sensory experience. And when people come in, they start to get intrigued. They fall in love, but they're falling in love with the experience. And we're really anchoring them into the experience of what it means to heal in a positive sense. So my background is in hypnosis, hypnotherapy. My wife is a naturopath by training who did her postdoctorate in genetic analysis. So her spectrum of medicine is incredible. For some of our patients, we might be prescribing a custom blended tincture. For others, we're looking at 400,000 different data points and figuring out what the best chemotherapy approach is for them. So it's a very, very unique thing, but what really I think is the most unique thing about Wheelhouse is that we are completely team-based. So from the moment you come in, you're sitting with someone who's looking at you from your cognitive perspective, someone who's looking from internal medicine, and from nutrition. And those three different dimensions are put together instead of you having to figure out going from doctor to doctor to doctor and piecing together that information. We're in a communication, in a conversation already about what is going on for you internally. And so it's a really unique place. You know, that team experience is not just in our staff, it's in our internship. We have one of our interns here. We make a really big point of having interns from all over in different backgrounds. We have interns who come from different countries and from different parts of this country, all with the same idea that we want different perspectives. We don't want to be in an echo chamber. When we're able to kind of step outside of that status quo, we start coming up with more innovative solutions. And that's really been the key to our success, is really not going with protocols. There's no protocols at Wheelhouse. It is looking at the individual, figuring out what does the individual say they need, not what do we think they need, and then thinking about all the different ways that we can approach that.
What folks in the audience probably don't know is that we've invited Adam tonight. He mentioned that he has a background in hypnosis. He's about to hypnotize all of us. So we want all of you to close your eyes.
Don't give me the chance. Don't give me the chance.
No. We don't want that at the library. I think we have a question.
I have a question about Wheelhouse. I love your approach. I think it's so smart. And so needed. And I was wondering how the holistic perspective takes social determinants of health into account when you're working with patients.
When we're looking at the patient, we're really thinking about who are they as the individuals. So there's a tendency to try and break everything down into its little buckets and its pockets and put everyone into their pigeonhole. But ultimately what happens is that when someone comes in, we ask them, what is it that you're really wanting to get out of this experience, right? They might come in, I was explaining this to Ilka backstage, they might come in with back pain, they might come in with a stomach ache, and they're coming in not really for that symptom, but they're coming in because that symptom is keeping them from doing something that they want to do, what we call the touchy-feely. And so part of that might be that their requirements are they need to be able to do what they need to do, whether it's play with their grandkids or to get up off the couch without pain. But they also need to do it in a certain budget. They need to take into account the religious background. They need to take into account the cultural requirements. We've had people who have come in from Asian cultures who we've given a nutrition plan and they said, no, I'm sorry, I have to eat pork. It's the Lunar New Year, and so what we're really looking at is saying, okay, we're going to take into account everything that you're saying is important. It's not just the one individual thing. So whoever you are, wherever you're coming from, we're trying to really answer that as the healing point. And then, getting rid of the symptom is secondary, right?
Thank you.